Welcome back to Great Day. A great smile can make a lasting impression, which is why more and more people are choosing veneers. But before you put your money where your mouth is, what exactly are veneers and are they right for you? Here to tell us what we need to know is the Texas Tooth Lady herself, Dr. Terri Alani. Hey there.
Hey.
All right, so veneers. A lot of people might know what they are because they've gotten them done, but there's new technology and there are other folks who are just now coming into figuring out what they are.
Exactly. So years ago, we had to take quite a bit of tooth structure down. Now we have what we call minimal prep veneers. Now veneers are thin pieces of porcelain, and they actually bond to your existing tooth. They reflect light naturally, like your tooth. They're stain resistant, and they're really the high-end technique of dentistry.
Because you can do a number of things. We're seeing right here, you can kind of elongate some things. Some things can make teeth look more even, and obviously the color can be changed.
Exactly. Now there's different types. A lot of people get confused with Lumineers versus veneers.
Okay.
So Lumineers is basically just a brand of a porcelain veneer.
Okay.
So a lot of labs, there's only one lab in the U.S. that makes Lumineers, and it can be either a ceranate veneer or a lithium disilicate veneer, which is called an EMAX.
Okay.
EMAX is very strong. Most of the dental labs outside of the Lumineer will do EMAX veneers. I prefer EMAX veneers because of their strength.
Okay.
So basically, all veneers is just a brand.
Okay.
So that's the difference.
Okay, and not everyone's a candidate for the minimal prep veneers.
Exactly. So if your teeth are incredibly misaligned or crooked, you might be better off with orthodontics, either Invisalign or traditional braces.
Okay, and somebody who's a good candidate for it would be who?
Okay, so a lot of people are good candidates. So let's go ahead and take a look. So anybody, you could have chipped or cracked teeth.
Wow.
So this patient actually had yellower teeth, so we not only whitened teeth, lengthened the teeth, but they were cracked, but you can see they're fairly straight.
Yeah, they're perfect.
So we barely reduce the teeth, and a lot of these patients don't even need anesthesia.
Ah, okay. And then we have our next picture here.
The next one is discolored teeth, and again, you can have a combination like this patient has some chipping as well, but we can also totally change the color. And if you notice, many people as we age, we lose about a millimeter of tooth structure every 10 years. So we lengthen the teeth. It makes you look younger.
And so it looks like it strengthens, it bolsters the teeth as well. And then a lot of people may have taken certain medications and stuff.
Exactly, and they're very thin. The minimal prep veneers are incredibly thin.
Okay.
Next. And then we have a lot of people hate their gaps. So we can either bond, but in this particular patient, we ended up doing veneers. I think we did 8 veneers, and you can also tell that we got rid of the staining.
Yeah, yeah, wow. Again, one of those things that medications can do at times.
Exactly. And then, of course, misaligned teeth. Now, if they're incredibly misaligned, you won't be a candidate, but this patient had fairly straight teeth, so we tweaked it. We do some modifications, and we modify the teeth a little bit. We do not go through the second layer of tooth structure, which is dent. We stay in enamel, and therefore, we can make them very thin.
Yeah, and there are a lot of times where you can just get what's visible when someone smiles, right? As
Exactly,
opposed to doing a whole lot of teeth.
Yes, and in this patient, you can see their front teeth looks like they probably opened up their teeth with bobby pins or what have you.
Yes.
And so we lengthen them. And again, these are 10 veneers. So we like to really go ahead and do like 6, 8, or 10 because we like to add to the buccal corridor.
Okay.
So we like to show a wider smile.
Okay.
And then, of course, small teeth. This patient not only had gaps, but smaller teeth, and you can see how we improved it, and they're very lifelike, and they reflect light just like your natural tooth.
Because traditionally people would say, okay, do braces, we'll bring them together in the front so you don't see that, but the time that it would take to do the braces, you can do this
Well, not
so
only
quickly,
that, you're not going to get the shape that you need, the ideal shape and the symmetry. That's why veneers are probably a better solution than the...
I just like that it's much quicker.
Well, they're beautiful, and they only take like 2 appointments.
All right, okay, so take us through the procedure.
Okay, so the patient will come in to see us, and we evaluate, make sure they don't have any decay, any gum disease, and then we do what we call a Lumi Smile. Now, Lumi Smile is a digital preview of the patient to see what their teeth may look like. As you can see in this patient, her teeth are fairly straight, but with some modifications, you can see how much whiter. Everybody wants white teeth.
Right.
So it's like a digital preview that the patient sees. Then, once we decide that we're going to go ahead and do the case, we will take a study model. This is actual study model of an actual patient. Before, we were going to close her gap and just make her teeth a little bit more symmetrical. Then the patient returns and we do the preparation. And it's minimal prep. On the right, you can see where we prepared the teeth, and it's not that much tooth reduction.
Right, right.
Then the patient comes out. Now, the patient will end up test driving their smile. So these are actual temporaries.
Okay.
These are the temporaries that the patient received after we did the minimal preparation. They can test drive the smile. They can actually wear it home. They can ask their spouse, their partner, whatever.
Stare in the mirror?
Stare in the mirror, and then they can come back to us and let us know what they like and dislike.
Okay.
So then we will take the impression for the final, send it to the lab, the patient comes back in, and we seat them.
All right. How long do they last? And of course, cost is always a factor.
Most veneers, this will tell you how long I've been practicing. I've had patients that have had them for 25 years.
Yeah.
You also want to make sure that you get a night guard to protect your investment, to prevent the grinding at night. And also, you want to make sure that you maintain your cleanings. And stay away from chewing on nuts or any really hard foods with your veneers.
Yeah, or opening bobby pins, right?
Exactly.
Okay. And then cost-wise, I mean, you get a beautiful smile. You do get a beautiful smile.
Okay, so here's the thing. I always say don't bargain with parachutes, heart surgery, and dental work. So any dentist can do veneers, and any lab can do veneers, but you need to seek out a lab that specializes in aesthetic dentistry, because a veneer is not just a veneer. A veneer is a work of art.
Yeah, you're a perfectionist with that.
Yes, you're going to have different artistic shading and things like that that you don't get with the typical crown. And dentists are not taught cosmetic dentistry in dental school, Deborah. So we have hundreds of hours of continuing education to actually get our craft. So you want to seek out two things: a great cosmetic dentist that has a great lab.
Yeah, yeah, and then somebody who has a great eye like you do. So like that's why she's the Texas Tooth Lady, right?
Yeah.